I've been using navigation in spine surgery for the last 7 years. I find navigation to be very useful for my surgeries. It adds an extra layer of safety for the patients that I'm treating. It's so critical to know exactly where we are during surgery with all these delicate structures nearby. And navigation really helps me feel even more confident that the surgery is being done, to the best of our ability for the patient. One of the other great things about navigation is when the patient wakes up from anesthesia, I know very confidently that all the instrumentation is in the right place and that we've been able to get the job done well. I've come to learn that the quality of support matters a great deal. Having someone dedicated running the software platform, providing real-time feedback regarding the position of components or making sure that the right images are up on the screen for the right components of the case, and really working as a part of the team is critical. And in fact, I think having a talented support team really helps decrease the stress of the operation, making sure everything goes really smoothly. I'd like to add that I think having a support team independent of the implant vendors that are there is also a plus, because it does not detract from the job of the implant vendors, so they can focus on the instrumentation while the support team is helping with the navigation. And working in concert as a team definitely does elevate the performance of the operating room. One of the things I love about working with Meta, it is a company that's entirely dedicated to the navigation component of spine surgery. As we see a lot of evolution in the technologies for image acquisition intraoperatively in robotics, and there's more computer-assisted spine surgery being done, having someone dedicated on the service side for intraoperative interpretation of imaging and facilitating with navigation is really helpful. I think it's becoming a more and more important part of the spine surgery operating room across the country as navigation is evolving into almost a standard of care for instrumented spine cases.